Folks, thanks for coming on the line with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes or so exploring a new option available in many states in the Medicare Supplement market. We'll spend a bit of time discussing specifics about the program and the compensation and tools that are put in place to help you be successful with this product rollout. Today's presentation is being recorded, and it, along with additional information we'll refer to through the course of the presentation, will be sent to all who have RSVP'd to today's presentation. A bit of background on Premier. We're a national marketing organization founded in 1968. That's part of the Integrity marketing platform. We have offices across the country acting as an insurance wholesaler, working through independent insurance agents, offering contracts at the highest possible commission levels with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means this past year we celebrated a milestone in our history, our 50th anniversary, and that's quite an accomplishment for what started as a small family agency in rural Nebraska that's become one of the largest producers in conjunction with its contracted agents in the Medicare space, in both the Medicare Supplement and Medicare Advantage markets. We do so through a full portfolio of products that includes a gambit of Medicare Advantage and Medicare Supplement programs and standalone Part D prescription drug plans, a full portfolio of life insurance and annuities, including final expense life insurance and pre-need programs, long and short-term care programs, disability income plans, and ancillary benefits, including dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio is very robust. It includes all the national carriers and many of the strong regionals that make a difference for you in your market. And that same philosophy carries over into the standalone Part D market, where the national carriers are there for your use through our organization. Our Medicare Supplement portfolio is very robust and includes a number of tools to help you be successful in this space, including the program that's being spoke of today. Our ancillary products includes all the leaders in the industry in the different categories, along with tools that help you offer these programs to fill the holes in the coverages for your clients and prospects, regardless of their age. And it helps you create not only another means by which to market, but another revenue flow for your agency. The Medicare market itself, well, you don't come on one of these webinars without someone like me speaking of the baby boomers aging in, where 10,000 people a day are turning 65, one every 8 seconds. And it's really kind of an astronomical number. But one of the things we need to keep in mind is the fact, just because someone's turning 65, it doesn't mean they're going to reference their Medicare benefits immediately. Many choose to work past 65, but then there are about a sixth of the population in Medicare that's actually under the age of 65, and it's part of that diverse Medicare population that we need a varied portfolio of products to address, because these folks have different conditions they have to address, and different Medicare Supplement companies address those programs differently through their underwriting practices, and a good portion of the folks are also, in essence, handicapped income-wise, where the median income has grown from this $24,150 in 2015 to a whopping $26,002 in 2017. And it gives us then an indication that there are folks out there that really need our help, and we need a portfolio of programs in order to address those needs. Folks do have a choice on how they can access their Medicare benefits. They can stay on traditional Medicare and either choose to do nothing and self-insure for the balance, or pick up a standardized, modernized Medicare Supplement program, and in many instances, a standalone Part D drug program to cover their needs. Some of them choose to go the Medicare Advantage route and access their Medicare benefits through a private insurer instead. And what we're seeing through depth research is it's about an even split for the folks that are accessing their Medicare benefits, about half and half into MA and Med Supp, and a portion of those folks staying with just original Medicare. So having not only the portfolio that addresses this need, but also the tools in order to help identify what is best for you and your market is very crucial. And we see where those numbers have changed just a little bit going into 2019, where more folks that had stayed on original Medicare in the past are making choices between additional coverages made available to them through the MA and Med Supp programs. Medicare supplements themselves obviously vary across the country, where penetration rates vary. You have some areas where Medicare managed care programs are more accepted, and you'll see a change in the availability in many instances in those states, along with the other programs that are non-standard and other states that have a birthday or an anniversary rule. So depending upon where you are, well, you might need different programs from your neighbor in the adjoining state. When we look at some of the changes that are coming about for Medicare supplements, we see the impact of MACRA coming into play now in many circumstances by the changes on how ratings are coming up on different quoting engines between programs, with the soon-to-be sunsetted for newly eligibles, Plan C and F, versus the Plan G or Plan N's, or some of the other programs that are being presented by the carriers with whom we represent. It's important to note that MACRA does not do away with Plan C and F. It just limits those programs to the folks that are currently on Medicare as of January 1st of 2020. So we're going to see those plans continue, and kind of a subset of the Med Supp market work through for those programs for folks that are already on Medicare. This gives you an idea of how these programs are going to change from 2019 to 2020. A kind of a graphic representation of the fact that the newly eligibles on Medicare will not have access to a Plan C or a Plan F, and that you're going to see some changes on the guarantee issue programs for those programs moving forward as well. That's where a quoting tool can be very, very valuable for you. And one of the things we do at Premier is make available to you our version of the CSG quoting tool, which gives you an opportunity to not only check out the market that you have chosen to target and make certain that your portfolio includes the programs that make you competitive, but it also gives you an opportunity to offer annual reviews with the use of a complimentary Medicare supplement review using this tool. And as you'll see in a bit, we're even folding in e-applications as part of this tool, made available without cost to our contracted agents as well. So without further ado, the Medicare supplement we're looking to speak of is an offering through Central States, CSO and CSI. And it is a very competitive program in many markets. And what we see is an opportunity to offer an AM Best rated A- excellent program where the carrier has 85 years of experience. They have traditional conservative business practices with a strong financial base. They offer the programs in a number of states with highly competitive rates and a very simplified online enrollment tool as well. It makes it very easy for us as agents to not only access the rates, but also enroll folks in the programs when appropriate. You'll notice on this map the states that are currently offered through these programs, either the blue with a new offering for CSO or the CSI Life program that has been reintroduced into a number of states as well. There are certain states, obviously, where the the map shows where the plan is not made available, but you'll see in the states where the program is offered that it offers that household discount of 7% as well. It has a lot of really cool marketing material as well that helps you sell the program. We realize that as people age into Medicare, we have an audience that is becoming less tactile. They don't need the paper. They don't want the paper. They do a lot of investigation beforehand, a lot of shopping, a lot of plan comparison up front. That's where a tool like the Med Supp quote engine can be very helpful to you. And that's where electronic versions of these materials can also be very helpful as well, because it enables you to supply the material to your prospects and your clients to make certain that they are comfortable with the product offering that you have, and they are very attractive and easy to read as well. You also have a very simplified guide that helps you walk through the e-app process. We're seeing the majority of carriers now move to a preference of electronic applications. And for those of us who are not as proficient electronically as maybe some others, this program is very simple to follow. And if I can do it, you most certainly can as well. It does a number of things for us as agents. It gives us the opportunity to make certain that the applications go in complete and legible. There are many people out there that write in the same handwriting style that I do, chickenese, and really difficult to read. That challenge is eliminated through the use of an e-app and the applications process much more quickly. That gives us an opportunity to make certain that we're able to deliver on what we are promising our prospects and clients or applicants, and do so on a timely fashion and aid in the speed of the issuance of the policies as well. These guides are available to anyone who contracts, obviously, and will be supplied as part of the follow-up to today's presentation. Once again, the advantages to that e-app process, well, not only do the policies get issued quicker, we also get paid more quickly as well. And in today's society, that's a big deal because everything's electronic. You know, when you go to pay a bill, the money sure goes out of your account really quickly. We want to make certain that we have our income coming in a timely fashion as well. It's also a very efficient way of making certain that the forms and the rates that we use with the sales process of these policies are up to date and easy to use. In the long run, it really saves you time as you become accustomed to the systems. It gives you the opportunity to move through things very quickly and efficiently. It also gives you the opportunity to track your business, particularly with applications that are underwritten or you might have some challenges with. It gives you an opportunity to track those applications in the agent dashboard and make certain that you stay on top of your business as well. It does make use of the FDA database for prescription drugs to aid in the enrollment process, the underwriting process. It really speeds up that process as well and makes certain that everything that goes through is accurate. You have multiple ways of obtaining a signature with this program as well. The electronic signature method gives you the opportunity of doing everything on the joys of Al Gore's invention of the internet. It gives you the opportunity to send the information all electronically. Obviously, the applicant then needs to make certain they have an email address and that they've selected the automated bank draft in order to process it correctly. And it also gives that applicant the need to review the documents via the email before signing them. It's a safeguard for us as well because it is then documented that they've gone through and agreed to the policy itself. You can make use of a signature pad as well if the applicant is present with you when you're completing the application. In those circumstances, you're reviewing the documents face to face with the individual and making use of that signature pad in order to collect the signature. The program also has a voice signature option, so a lot of things can be done telephonically. Once again, all the documents are sent via email. The applicant has the chance to review them in order for us to make certain that we stay in compliance. They are, once again, required to have an automated bank draft for this to follow through. And it gives us then an opportunity where we can call in when we're with the client, be it face-to-face or telephonically, or you can schedule a time for that voice sign application to be completed. And then, of course, there's the old dependable where we're working with paper, and the applicant can wet sign the documents, which can be either uploaded to them, faxed, or emailed to that individual for that signature and its return. Some of the other things that are key here for us, we mentioned a bit ago that the FDA database for prescriptions and common dosages are used. It's important for us to make certain that if a medication is used for a different purpose, that we speak to that use and make certain that the underwriters understand why a medication is being prescribed. That happens upon occasion. It is also important to note that the initial premium for the policy can be drafted either upon issuance of the policy or upon its effective date, and they have the flexibility to have that premium drafted on any day of the month. So it's not a circumstance where hey, it's the 1st or the 15th, that's the way it is. You have the flexibility of drafting it on any day of the month. One of the reasons why this program is really hot for us now is the marketing allowance that comes with the program. One of the first things you'll notice with this is, unlike some of the other carriers that are out there, you qualify for this allowance with a single application. If the supplement application going in is underwritten, it's $125 additional for that application. And if it's a non-underwritten Medicare Supplement application, it's an additional $75 for you. That allowance applies for either carrier in the appropriate states. There's no application limit, so you can earn as many per application as are submitted. And it's also an opportunity for you to carry through this particular incentive through the remaining next 2 months of this quarter. So it still applies in August and September, and those marketing dollars are paid out monthly. So you have an opportunity to not only build on a very well compensated commission-based product, but also a marketing allowance based on production with a single application. The contracting process for this is very simple as well. Everything is facilitated online. You'd receive an email with a link to the contract. You complete it electronically, and it processes very quickly. Much of the same philosophy that comes into play with submitting an application electronically, well, it applies to your contract as well. It's legible, things are automatically fitted into the system, and it does away with that challenge of handwriting challenges or having the contract go incomplete where they chase you for additional information. The company has come up with very, very attractive marketing materials as well that you can make use of either through direct mail campaigns or electronic campaigns. One of the things that we're seeing with much greater frequency, because agents are using e-applications more and more, they do capture the email address of their prospects and clients, and it gives them the opportunity to create a newsletter and an additional means of marketing electronically. It's much more nimble than the old snail mail. It's also much less expensive, and you have attractive, compliant pieces already in play that allow you to plug in your information and move quickly with it. It then also allows you to target very specifically into areas that are very attractive to the population we're reaching out to, simply because the program is so competitive price-wise. Here's some additional samples of some of the pre-approved marketing materials. So you can actually use this in a trickle system as well, where you can reach into the same market on a regular basis and kind of farm and become the owner of a particular market that you are pursuing. So once again, why would you want to pick up this contract? Well, it's an A- rated carrier according to AM Best. You have a lot of insurance experience behind it, 85 years of it. It's very simple to read and understand. The rates are very competitive. It's much less expensive. The underwriting is very predictable. So you don't have a lot of questions as to how are things going to run. And you'll see too that on the quote engine, you have an opportunity to plug in different medications and health conditions that make it much more predictable to underwrite and very much more simple to process. That simplification in the processing also gives you the opportunity to do things very quickly and on a timely basis. Once again, additional information as to the marketing material that gives you an opportunity to reach out to your prospects and clients with a product that has all the background that you need in order to be a stable program for you moving forward. Why you'd want to do these programs with us here at Premier? Well, we're going to lend some additional assistance in the marketing of this Medicare Supplement program from CSO, CSI. You have an opportunity also to create an agent profile, insurance bay, and contract with additional carriers to add ancillary product, dental products, critical illness, cancer programs, final expense programs, other insurance programs for the Medicare space as well, and do so very quickly and easily. That same concept that we talked about with an e-application or the contracting directly through CSO, CSI carries on here as well. A great way for you to store all your contracting information in a single database and make things much easier for you. We also give you the opportunity to protect yourself on a discounted basis. We offer errors and admissions coverage through a special arrangement with 360 Coverage Pros, where this E&O covers you regardless of where you contract for the programs that you offer. We realize that as an independent agent, you have a ton of choices as to the programs you offer and whom you offer them with. This gives you an opportunity to make certain that you're covered regardless of whom you're contracting through. This makes certain that your coverage for you and your agency is in play at a very reasonable discounted cost. We also make certain that your license stays in play too through online CE bundles that make certain that you have your continuing education covered as well. We do so through our relationship with WebCE, and it's a great way to discount these programs. We also offer an opportunity for you to pick up DI coverage on a modified guarantee issue basis, where you have a discounted rate for these policies and you share in the commission of these programs. It's a great way to protect your income as an independent agent for a policy you take on yourself on a discounted modified guarantee issue basis. Much as today's program is being recorded, we also offer other programs on other product and other marketing opportunities as well. There's a lot of activity right now in the Medicare space with the retail programs being in vogue and offered by not only Walmart, but different carriers as well. And in many areas, that requires having competitive Medicare supplements as part of your portfolio. So these programs and the recordings are available to you 24/7, either at our website at premiersmi.com or on our YouTube channel, so you can access them whenever you have the opportunity to do so. Additionally, many times when you speak of Medicare supplement programs, inevitably the concept of prescription coverage comes into play. And when that happens, obviously you have different compliance rules you have to follow. That scope of appointment is necessary for you to have in hand before specific discussions on product proceed. The program that we offer through Medicare Center not only gives you the opportunity to enroll people in Medicare Advantage and prescription drug plans remotely, it's also a key tool for you to use to not only collect that scope of appointment, but store it compliantly as well. That 10-year period, well, gee, where are you going to do that and make certain that it is held protected? The Medicare Center program gives you the opportunity to do that. It also can act as a CRM for you, where you can input information on the folks that you visit with, those that you sell, and those that you don't, so you can do regular reviews with your prospects and clients, and not only drive a higher persistency rate with the folks you sold, but also give you a chance to revisit the people that might have made a different decision. We are adding an e-application to that quote engine as well that you will see is very, very handy for programs where the e-app may not be as friendly as it is with the CSO/CSI program. We do also offer a program to put your social media marketing on autopilot through Coverage Made Easy. We're seeing a lot of very strong results through Facebook leads. And this is a great program that enables you to set up a consistent program and access social media in order to get in front of people as well. We also want to make certain that you are well aware of all of the compensation that is due to you through your sales efforts, not only with the sales incentives that we discussed earlier for CSO/CSI with the 125/75 additional marketing incentive, but many carriers also offer you the opportunity for trips, and we do so here at Premier as well through our producers convention. Production through CSO/CSI gives you the opportunity to qualify for a cruise from Miami to the Bahamas that we're doing next April. It gives you a great opportunity to worship the sun. And so if you're one of those folks, this is a true trip you really need to aspire to. Some of the other things that we can do to you and for you is make available marketing opportunities through a number of different avenues. And it includes a contact list that can be tailored to your circumstance, a call list that gives you the opportunity to make use of that tried and true Ma-Bell relationship and reach out into the community offering the Medicare supplement review and rates through CSO/CSI. Some states don't allow that, so we want to make certain that we stay compliant and that we're handling that in the fashion that you need. Many times, however, the same database can be used for a direct mail campaign, so there are a number of other uses for this list that we can make available to you. It's either deeply discounted or available without cost at all, depending upon your contracting situation with our organization. I mentioned a bit earlier the activity that's going on in the retail marketing space as well. We do have opportunities still in retail. In many circumstances, this means carrier-specific opportunities because the Walmart selection process has closed, but there are still other marketing opportunities through market venue locations across the country, some states more than others. And one of the things that we also do is set up a track for you to follow to market to folks through area centers of influence. And one of the strongest centers of influence are faith-based organizations. So we have different programs that help you approach these communities, and then also sales tracks to follow in order to offer informational programs to these folks who may not respond to any other type of marketing outreach. It gives you a venue that is a trusted environment for the prospects and gives you the opportunity to reach into a community and grow the roots and control that area through working with these centers of influence. And one of the things that you'll find is not every provider is part of a network with a Medicare Advantage program. And even if they are, in many circumstances, they carefully monitor their payer mix and want to maintain different Medicare supplement coverages as well. This gives us the opportunity to present our expertise and offer the providers that we target the chance to work with a qualified agent that offers Medicare supplement reviews to make certain that they are ensuring additional coverage for the patient base of a particular provider, be it within the medical realm, or if you're going into a area such as dental providers with dentists that give you the opportunity to reach into the community a bit differently than with just a medical doctor. Many of the carriers do generate prospects as well. What you're seeing with CSO, CSI is the marketing allowance that generates that additional revenue to help make certain that your marketing mechanisms are a well-oiled machine. I mentioned the fact that we are working diligently to provide Facebook leads. Our final expense department has done a very thorough job in investigating our source with this organization. It's been very successful for them. If you work that market, I would strongly suggest we get you in touch with folks in that department to make certain that you can access prospects in multiple areas and create multiple revenue streams for yourself and your agency. We do also offer direct mail support based on production, where we deeply discount the cost of a regular mailing based on your production through one of our preferred lead vendors. We use preferred lead vendors simply because we want to make certain that we can keep everything compliant as well to protect you and ourselves as part of this support system. All that said and done, what we're looking for is an opportunity to work with you as we want your business. There are a number of questions that are coming up, and one of the first ones says that they are on Medicare Center, you mentioned, and you're trying to create a Med Supp quote, and it says there are no plans available in your zip code. Well, Medicare Center is for Medicare Advantage and prescription drug programs. It is the quote engine through CSG that actually generates the quotes for Medicare supplements, and we'll demonstrate that very shortly for you as well. So that's a different quote engine than Medicare Center. Even though it has a Medicare supplement button, excuse me, that is not a function within that system that is currently in use. For additional information on some of the other marketing campaigns that we mentioned, someone is asking for additional information on faith-based organizations. We'll make certain that you have the follow-up recording to the presentation that we've done there as well. And there are additional materials that will get you as well that are leave behinds and different sales tracks to follow with that program. To get involved with the Facebook leads, we'll reach out to you directly and make certain that we are tracking those in the areas in which you wish to target. Additional questions: does CSO have a certain demographic where they are the strongest? What we're seeing across the market where it's been introduced, it's generally in the top 3 programs when it comes to the premium offered across the board. The sweet spot tends to be between 67 and 72 thereabouts, and that can be a strong point for you. If you already have a contract with CSI, as they introduce CSO in some of the states, it will replace that program, and there's just an additional form that we need to put in play for you. Additional question: how accurate are the quoting tools regarding up-to-date rates? CSG is very fastidious in following up with all the carriers. As soon as a new rate comes into play or is announced, you'll see it in those systems. We've had very, very, very few challenges with making certain that the rates are what they actually are in the time frame that you're quoting. And that's one of the reasons why it will ask for an effective date as part of the quoting process. I'm going to do a really quick demonstration with this as well. Pardon the delay. So as you request access to the quoting tool, it is made available to you as a contracted agent with Premier without any cost to you. And I've got to tell you, if I can run this thing, anybody can do it. It gives you the opportunity to look at a number of different categories with the Medicare Supplement program that we'll illustrate very briefly here in just a moment. But it also gives us the opportunity to get additional data about Medicare Advantage programs. For those of you who are active in that space, some markets are dominated by one carrier or another, and it's difficult to move the coverage when it's not in. Obviously, you don't want to do that if it's not in the best interest of your prospect or client, but it gives you an opportunity to cross-sell. There's a neat little tool that comes with it that enables you to add on dental coverage or hospital indemnity programs as well. There are a number of carriers that are being added to the e-app function right through this quote engine as well. It gives you also the opportunity to do final expense, HIP programs, and dental programs as well. But when we look at Medicare Supplement programs very quickly, it's zip code based. Let's do this to make certain we're accurate. Bear with me. My system just likes to go forward and not backwards. Bear with me. Let's do this. Pardon me. By the way, a copy of this PowerPoint will come as part of the follow-up to today's presentation. So, since the world revolves around me, and I live in Texas, and Texas is one of the states, let's take a peek into a zip code here. Let's go for effective date tomorrow. Let's look at the plan G. And let's take a peek at a 68-year-old non-tobacco using woman. It'll think for a second. And it lays out then the different programs that are available to you, including additional marketing analysis that tells you what happens as a person ages and what their average rate history increases have been as well. And you'll see in this market, this is Lewisville, Texas, CS Central States comes in number 2 on a G plan for a 68-year-old non-tobacco using lady. So you'll see then it also gives you an opportunity to pull off a PDF of the application. Should you be tactile and your prospect wants paper, it gives you the opportunity to do so. It gives you also the opportunity to apply some of the discounts that come into play, which factors in that 7% household discount and how that can favorably affect the price for our prospects and clients. So a really neat little tool that can make a difference for you in not only how you market, but how you market accurately and on an up-to-date basis as well. I'm going to take a peek one more time to see if any more questions. One of the questions that come into play is the Medicare Center. Are we going to put Med Supps on there? That is anticipated, but they're looking to make certain that they do so and it doesn't jack with the system, so to speak. For those of you who have sent the scope of appointment to yourself, it didn't ask for a beneficiary ID number. Part of that is to make certain that we stay compliant with PHI, but it does collect the information necessary to make that scope valid. The commission levels on these programs will vary according to production, but they are among the highest in the industry, and that information will come to you from your marketer as well. I think you'll notice it too. Someone's asking about the rate history and what it's coming into play. The rates have been single digit historically on an annual basis. And for those asking for specific rates, we're going to make certain that we send those to you for your target market in the state that you are pursuing. So all that said and done, you can reach any of us here at Premier Marketing through our toll-free number at 1-800-365-8208. If you're working with a marketer now, they'll connect you with that individual. If you're not working with anyone presently, we'll make certain that we get you the information that you need in a very timely basis. You can also access additional contact with us through our website at premiersmi.com. I want to thank you for the investment of your time with us here today. We realize that's your most precious resource. We feel that this Medicare Supplement program can be a valuable add to your portfolio and place you very favorably in the marketplace that you're pursuing. We invited agents in those key markets to today's presentation, and that's part of the reason I speak with such confidence. That said, watch for the follow-up information we'll be sending you and for follow-up conversations as well. We look forward to that visit, and in the meantime, we wish you good selling. Thanks so much. We'll talk with you soon.